Last week we shared about a testimony that shows it is possible. If you haven't seen it, kindly get to our YouTube channel and our social media platform, subscribe and follow, so that when we share these stories, you get to know easily. Okay, today we meet Tracy's doctor. We tracked him down and he agreed to talk to us. What he shares is so important for you to know, and this is our interaction with Dr. Parker, a laparoscopy specialist. Karibu sana.
Hello everyone, hope you're well, and today we are here to bring you fertility tales, and we are so privileged to be with Professor Parker, and we shall be asking him a few questions about the success of Teresa. Teresa went through laparoscopy and she succeeded, and now she has a baby. So we really are interested to know what Dr. Parker did, because Teresa had gone through 2 failed IVFs, and finally when she came to Dr. Parker, she succeeded and she's a proud mother of a son. So please help me welcome Dr. Parker.
Good morning. Yet again, we are here to discuss the issues regarding laparoscopic surgery, in particular with the value of laparoscopic myomectomy, that is the removal of fibroids through this keyhole technique. You don't need to do open surgery for fibroids. There are certain fibroids which we can successfully remove laparoscopically. In this case in question, this is a patient who had been married for 6 years, had 2 failed IVF cycles, had 4 fibroids, one of which was 8 centimeters, and we successfully removed them laparoscopically. And fortunately, within a year, she conceived, and we delivered a live baby for her.
Professor, thank you very much. We really needed to know, like, what was your interaction with Teresa when she came here? What kind of a person did you see? And when you went to the theater, what did you get? And how did you get to do the procedure?
Most of these patients are quite anxious because fertility is always on their mind. They go through a lot to try and achieve fertility.
When you got in there, how was the lining, and how were the tubes? How did you get to know that now you have successfully done the procedure? What do you call a successful procedure?
So successful procedure 1, is to remove the fibroid. 2 is to try and restore the integrity of the cavity of the uterus, the lining of the uterus, and 3 is also to make sure that the tubes have not been compromised. Now, unfortunately, during surgery, there are some things which we cannot do immediately because the tissues are raw. We want them to heal, and healing sometimes occurs with scarring. So usually we do an assessment after about 6 weeks whether the surgery was successful or not. But fortunately, in Teresa's case, she didn't even wait for that assessment, and she conceived before we did that assessment. So that means whatever we did during the surgery went well, and she was fortunate to conceive.
Professor, I really wanted to know, like, when you get in there, when you want to check on the tubes, how do you check if the tubes are open or blocked?
Normally we use methylene blue. which is a dye, which we push through the cervix, and we follow the dye along the tube and make sure that the dye spills at what we call the femoral end. But in post-op cases, we don't use methylene blue. I use a mixture of 3 drugs. One is an antibiotic, one is an enzyme, and the third is an anti-inflammatory. So this enhances the healing of the tube if we have operated in the region of the tube. And that is why I say we don't do an assessment on the table if we remove the fibroid, because there will invariably be issues during healing. And normally we do that assessment after about 6 weeks.
There are people who go to do like IVF procedure and they're told that the lining is too thin. What is that?
So the endometrial lining is the lining that is shed during a period. And normally at the time of a period it is about 12 to 14 millimeters thick. So once it loses its hormonal support, that whole layer is supposed to shed. And then the following month a new layer is formed. Now, if the lining is too thin, most likely that lining is not receiving sufficient hormonal support. So with regards to estrogen and progesterone, if the lining is too thick, most likely this is a hyperstimulated endometrium, whereby she has been given a lot of drugs to try and make sure she conceives. And those drugs actually make the lining very thick. Now, if it becomes very thick, then again conception becomes compromised. Because these linings do not accept the fertilized egg very well if they are very thick.
So what is a normal endometrium? What is the size of a normal
Between
endometrium?
12 to 14 millimeters.
Between 12 to 14 millimeters.
So just at the time before the period, if you do an ultrasound, it will say ET, that is endometrial thickness, 12 millimeters.
So it's between 12 and to 14. And I've been telling people it is important to do an endometrium scratch. I don't know what you think about that before they do the procedure. Or what is that?
I think endometrial scratching was a fantasy that came in for some time. I don't think many people are doing it now. So before you implant the egg, the fertilized egg, you damage deliberately damage the lining of the uterus, the endometrium. So that the theory is that implanted egg will go under the scratched area and fix there. But I don't think many people are doing it anymore.
And that is why I really wanted you, Professor, to emphasize the importance of the endometrium scratch, because I'm seeing people doing the first, second, third, fourth, fifth IVF and they're failing and they keep on repeating the same mistake. And I'm seeing the need of us just doing that hysteroscopy through, I don't know, just explain to them.
She requires to do a complete assessment of the uterine cavity and the uterus, fallopian tubes and the ovaries. And that means repeater. If hysteroscopy has been done, repeat the hysteroscopy and repeat the laparoscopy. And there are so many times that we find issues that were not picked up or addressed during the previous laparoscopies. So I don't normally accept a laparoscopy or hysteroscopy done by somebody else. I like to make my own decisions.
True. So most of the time is when you get in and find that there's something that was not done. Okay. So the other thing I wanted to know is what advice would you give to people struggling with infertility?
My sincere advice is, when somebody presents with infertility, it is the first contact that is extremely important.
True.
And if the right thing is not done the first time, then subsequently it becomes extremely difficult to achieve fertility. And the standard example I'll give you is somebody comes to see me, history of infertility, 3-4 years, has had 1 or 2 laparoscopies already done, but she still hasn't conceived. And then when I do the laparoscopy, I find endometriosis growing outside the uterus, which was not picked up the first time and the second time. So the endometriosis causes scarring and causes other hormonal issues that prevent a pregnancy from occurring. So the first contact is extremely important.
So you would advise them not to just what would you advise them? Not to just go in for the first time. It's good to get different advice from different doctors.
And then make a decision.
Then make a decision. Okay, thank you very much, Daktari. And I would want you to give us a parting shot to just get to know where you are, what you do, and maybe advise us on something.
Like I said, my passion is for hysteroscopy and laparoscopy. I'm involved in a lot of teaching all over the continent. I'm on faculty at the University of Cape Town. I also train doctors locally. And the important thing, the message to the younger doctors, learn these techniques because this is the future. And for the patients who are seeking advice, don't make a rash decision initially. Seek different opinions. It's your right to seek opinions and then make up your mind.
Wow. Thank you very much, Professor, for that very rich information that you've given us. And thank you for always being there to advise us and tell us what we need to do and what we don't need to do. Thank you even for Triza. Triza said we tell you thank you very much for the success. They are so happy as a couple. And in fact, they're the one who called us for the interview. And we were so happy that they did that. Thank you so much, Professor.
Yeah.
And for I've seen so many people have really congratulated you for even enabling hold their beautiful babies. We really appreciate you. Asante sana.
Thank you.
That is how it was. And thank you very much for always tuning in to our YouTube channel. Please always share this rich information and also subscribe to our YouTube channel. And also remember to call us to come to you for this interview. We always say that you are an ambassador wherever you are. You need to preach the good news of fertility so that we can end the stigma behind infertility. Thank you very much. It has been your host, Cecelia Karanja, Fertility-Kenya. Asante.